So when it's a multi-system disorder, you call the rheumatologist.
So you get to play the detective role?
Your body's own immune cells are actually attacking the various parts of your body.
Do we have to be on these medications for lifelong?
It's like a boxing match where we hit the disease hard.
So welcome to the program, Doctor, and it's a pleasure to have you.
Thank you so much, ma'am. Thank you.
So rheumatology, I'm sure this field is not something what we all hear it every day. So what made you choose this specialization, and tell me something more about your medical journey?
When I was doing my junior residency in internal medicine, one of the things that really motivated me was to be a part of all the organ systems and be involved in the management of all the organ systems, because that is the essence of internal medicine. So one of the subjects that I really found that was close to this was rheumatology. So what does a rheumatologist actually do is actually we would look after all the organs and we would see the manifestations in all the organs. We mostly know rheumatology as a joint. It is the doctors who deal with the joints, but it's not so. We deal with the entire body, and that is what fascinated me.
Pretty much every organ in the body.
Yeah, exactly. So when it's a multi-system disorder, you call the rheumatologist. That's where the role of the rheumatologist.
So you get to play the detective role?
Yeah, that is what actually fascinated me. So we find out when there is a lot of things going wrong simultaneously, the patient is sick, and then we can really come into the play, and then we actually and then we find out the various causes, and then we can treat them. And the best part is the outcomes are really amazing sometimes, and in most of the times.
So for someone who's not into medical world, when do you think they should see a rheumatologist, or how do you describe your job line?
People are often confused when to consult a rheumatologist. First thing, joint pain. So when you have something called a early morning stiffness, we wake up with a stiffness in your hands or your feet or your general body. You have stiffness in your lower back, in your neck. And so these are the early signs which we can see in early arthritis. From the other perspectives, sometimes ILDs, the interstitial lung disease, that is, you have a chronic cough, you are having shortness of breath, those things might also need a rheumatologist opinion. Second of all, something like the skin lesions with some joint pain, these can be early signs of vasculitis. The other things that we usually see is some things like psoriasis. Patients usually have psoriasis, and then the psoriatic arthritis develops. So the psoriatic arthritis also falls in our purview. Our ophthalmology colleagues would be referring to us because patients develop uveitis, and that is sometimes the early rheumatological diseases which are localized to the eyes and have not spread to the other parts, but to prevent it from spreading and to early detect it. So the rheumatologist has also a big role to play.
So, these days we are talking about autoimmune inflammation. There's a lot happening with this. So how would you explain this to our viewers?
So what happens is here, instead of an outside agent actually damaging your body, which we see in infections, your body's own immune cells, that is the T and the B cells, are actually attacking the various parts of your body. So what is happening, the immune cells get hyperactivated because of some underlying trigger that has happened, and then it is attacking. So when it attacks the walls of the blood vessels, it is called vasculitis. When it attacks the synovium around the joints, that is the covering around the joints, it is usually called arthritis. And when it involves the lungs, it causes ILD.
And you've mentioned, there are some triggers. That's the reason your own body cells attacking the body. So what are the things that trigger us?
So that is an excellent question, actually. So that is actually asked to us by a lot of patients who are suffering through this, because why did this happen to me? That is one of the things that is really their main question. Among the things that we know, sometimes what happens is subclinical infections, that is infections which has not really flared up. Sometimes pollution is also attributed, and really a majority of the factor is genetics. That is, the underlying genetic factors are there in the body which trigger the immune cells from getting activated. One more thing really I want to say here is that young females really develop a lot of these autoimmune diseases, and so the hormones like estrogen and progesterone are also known to play a big role. So there is a change in the rheumatological conditions that occur premenopausal and postmenopausal.
So, talking about stress or in general lifestyle, what changes do you think we should make?
Yeah, great question. So, first of all, the first thing is we need to reduce stress in the day to day activities. The pollution also plays a part. So, the point is there is an entire disease spectrum, which is a chronic fatigue syndrome and fibromyalgia, which is entirely attributable to the stress factors. So, the main point there is to reduce the stress. In general, also, the stress can lead to or irregular diet habits. There is regular fast foods and all these things that we are consuming on a day-to-day basis are known to trigger autoimmune conditions. So these things might be a factor that we are seeing the surge in autoimmune diseases in the recent times.
Another common question we get to people ask us is, do we have to be on these medications for lifelong?
Yeah, so it's not a lifelong therapy for all the diseases. So it varies from disease to disease. Like for many diseases like systemic lupus erythematosus or SLE as we call it, or vasculitis, we usually, first of all, it's a two-phase therapy. First is the induction. It's like a boxing match where we hit the disease hard really fast, and then when the disease is really weakened, we then keep on hitting it slowly so that it remains in its low condition.
So, rheumatology being a very detective kind of a subject, as you've discussed earlier, what are some common myths that you would like to clear for us?
Yeah, first thing, the myth is that rheumatological diseases always needs steroids in high doses. That's not true. Second of all, it's not always a lifelong treatment as also has been described. Third of all, one of the things that patients ask is it contagious? It's not contagious. Also, not all the diseases are passed on to your children.
So, have you ever wondered if you weren't a rheumatologist, what would you be doing?
If I was not a rheumatologist, I would stick to internal medicine because that is the closest thing to rheumatology. Actually, the best things of being a rheumatologist is that I can interact with all the specialities. So it just keeps all the windows open and it keeps me updated, which I really enjoy as being a rheumatologist.
That's very beautifully said. And finally, doctor, what message you would like to share with the viewers out there?
So one thing I would really like to emphasize here, that these diseases are rare diseases, but you are not the only one who is surviving this. A lot of people are fighting this, and with the doctor and the patient, we can both fight rheumatological diseases strongly, and so that we can maintain the remission and no symptoms. There are multiple self-help groups and the patient groups which are available, which can come to your help. You consult a doctor whenever you have any queries, any doubts, so that you do not get off on the wrong track, because stopping medicines suddenly is one of the main reasons why the thing flares up.
So, thank you, doctor. This definitely was an eye-opening conversation, from busting myths to knowing how your autoimmune system works. So, thank you.
Thank you so much. It was a really nice talk.